Hi, my name is Imelda Williams, and I'm going to introduce you to the clinical portfolio for RAD5109. There are two sections to the clinical portfolio. The first one will involve cases that you need to write up, and that should be a minimum of 6 cases. And then you will also have to do a preliminary image evaluation, self-auditing report, and that will include providing statistics and then also a brief reflection. So as mentioned, I'm the academic responsible for the RAD units RAD5109 and also the clinical portfolio, and there's my email if needed. So for the clinical portfolio, this applies to learning outcomes 2 to 5, and then you can refer more in detail to the learning outcomes in the unit guide. So the resources then will be the unit guide, the Moodle site, the image interpretation manual, and then also the video recorded presentations. So for the clinical portfolio, the overall weighting is 25%. As I mentioned, there's 2 parts to it. So you need to submit a minimum of 6 clinical cases, and then also there will be a minimum of 10 self-auditing PAE records. And the submission deadline for this is Friday, the 28th of June at 5 p.m., which is the last week of the exam period. So for the 6 cases, the total marks for that will be 30. Each case should be around 200 words and should cover the range of body regions related to the pelvis, lower limbs, and thoracic and lumbar spine. You can use references to support your discussion. Include in the case, as applicable, mechanisms of injury, justifying the examination, the projections undertaken, and then also, if necessary, were there any additional projections, and then provide de-identified images to each of the case. You then need to provide a preliminary image evaluation of the case, and then compare your PIE to that of the radiologist's report. And then, if applicable, you can discuss the patient immediate management. So the marking rubric for that, so you can see that there's 4 areas that needs to be included, and there will be a maximum of 5 marks per case available. For the PIE record, you should include a minimum of 10 reports, which would cover the range of body regions, the pelvis, lower limbs, and thoracic and lumbar spine. You then need to work out the true positive, true negative, false positive, or false negative, and then calculate the sensitivity, specificity, and accuracy, and provide a brief reflection on your PIE abilities. So for the 10 reports that you prepare, that will be 10 marks for the calculation of the sensitivity, specificity, and accuracy. And there you've got the formulas. That will be 6 marks, and the reflection will be 4 marks. So you need to allocate the true negative, true positive, false negative, and false positive. Sometimes it's necessary to use fractions, use your own judgment, and that is because some of the cases might have more than one abnormality, and you need to summarize your results in a proposed spreadsheet and then calculate the sense, spec, and accuracy. So to work out the true positive, so that means that the radiologist report states that the case is abnormal. If you agree with the radiologist that it's definitely abnormal or that it's probably or possibly abnormal, that will then be a true positive. So looking at the true negative, that's where the radiologist report states it's normal. You agree that it's definitely normal or possibly normal, that will be a true negative. For false positive, that's where the radiologist report states that it's normal. However, you decide that it's definitely abnormal or probably or possible abnormal. That's a false positive. And then for false negative, that's where the radiologist states that it's abnormal. However, you indicate that it's definitely normal or possibly normal, and that will be a false negative. You then need to pop that into the 2x2 table, so all your true positives, you add that up, your false positives, your false negatives, and true negatives. And then put that into the spreadsheet, and you can see there's a range of body areas that needs to be included. And the total for that will be 10 marks. So in terms of sensitivity, you need to keep your sensitivity rate as close to 100%, which will mean that you are able to pick up all or most of the abnormals and have very few false negatives. For the specificity, once again, it should be kept close to 100%, and that means that you are able to pick up most or all of the normals and have very few false positives. And this is really good because it's in the area where there's a high risk associated with unnecessary treatment. So the accuracy rate is the ratio of true positive plus true negative results to the number of patients studied, and there is the formula to work that out. So in summary, for your clinical portfolio, you need to have access to images, and you need to collect a range of those clinical cases, and then include also normals as well as abnormal cases. If you have any issues, please contact me. You have got my email. So good luck with the clinical portfolio. Thank you.